We are going to get started. Welcome to this budget webinar. My name is Benjamin Orr, and I am the founder, president, and CEO of the Maryland Center on Economic Policy. MDCEP is a research and advocacy organization that believes every Marylander should be able to achieve their full potential in a healthy economy that offers a widely shared and rising standard of living. And our state's budget and tax policy has a tremendous role to play in making that vision a reality. So I'm going to be giving a general overview of the governor's proposed budget, very top level, and then the rest of the members of our research and policy team are going to offer more detail about their respective policy areas. We will try to get to as many questions as we can, but there are a lot of you on this webinar, and we may not be able to get to all of them. So please submit your questions at any time using the Zoom Q&A feature at the bottom of your screen. We will do our best to either answer those during this call or follow up afterwards if possible. So let's get to it. When Governor Moore introduced his budget this year, he had a significant hill to climb, the largest budget gap since the Great Recession, nearly $3 billion shortfall just in the state's main operating budget, what we call the general fund. Maryland is required by our Constitution to pass a balanced budget, and so the only options to achieve that were either cutting services, raising new revenue, or some combination of both. What the governor opted to do was a mixture of those options. His budget includes just under $1 billion of new ongoing revenue to support the general fund and about $1.3 billion in proposed funding cuts, with the remainder made up through the use of reserve funds and other one-time actions to balance the books. I'll go over a few details in just a moment, but I want to first talk about how we got to this point. Excuse me. So policymakers have been addressing small deficits in the budget year after year since at least the Great Recession, mostly by making cuts or using one-time funds, with the exception of a couple of years, particularly during COVID, when there were significant one-time federal funds. Now, the deficits are getting larger, as the state's growth is not keeping pace with the costs and needs for public services. We have some very strong fundamentals in this economy. Low unemployment, wages are growing, but we also have an aging population with fewer people in the workforce, so overall growth is slow. We also know that few programs are growing very fast due to higher need, including Medicaid and the Child Care Scholarship Program. The state made a big commitment to public education, the blueprint for Maryland's future, but only figured out how to pay for part of it. And there's always natural growth in the baseline expenses of running state government due to inflation, the need to give employees annual cost of living adjustments, and other increases that are included in state statutes like Medicaid provider rate increases. Finally, we are in this position because policymakers have declined to adopt any major new revenue sources, even as needs have increased. So how did the governor address the budget gap? Well, he proposed a tax reform package that is largely centered around making our income tax system more balanced, as well as closing corporate tax loopholes. Maryland's tax system, as many of you have heard me say before, is upside down, with the wealthiest 1% paying a smaller share of their income in state and local taxes than anyone else. The governor therefore proposes to add upper tax brackets at $500,000 and $1 million of income. He proposes to eliminate the itemized deductions and to double the standard deduction. He proposes strengthening the state child tax credit by giving families a partial credit as their income increases. And the consequence of this package altogether would, as we said, raise about $1 billion, but at the same time, achieve the goal of lowering income taxes for most mainlanders, or at least who would see no change in their taxes, based on the administration's analysis, and we're still working on our own. The governor has also proposed updating the corporate income tax by adopting what's called Water's Edge or domestic combined reporting, and by lowering the corporate income tax from 8.25% to 7.99%. He also proposes restoring the millionaire estate tax exemption to $2 million from its current level of 5, and eliminating the inheritance tax, which is expected to be revenue neutral, those two policies combined. He increases taxes on mobile sports betting and table games, and increases the cannabis tax rate from 9% up to 15% to balance his budget. There's also an ongoing shortfall in the state's transportation trust fund, despite the legislature taking some important actions last year to increase registration fees and other vehicle-related fees. So Governor Moore's budget proposes several new revenue options to support the transportation trust fund as well. In the budget, and we'll get into more detail later, but the big picture is there are some really big cuts in a couple of different areas. The first major proposed cut in the governor's budget is to slow down implementation of portions of the Blueprint for Maryland's Future, including giving teachers more time out of classroom for collaboration and planning, and slowing down the expansion of community schools. There's a $230 million cut to the Developmental Disabilities Administration on top of nearly $100 million proposed to be cut from the current year's budget, which ends June 30th. There's a $100 million cut in four-year universities, which represents about a 4.6 decrease in their budget, and the system's budget. The governor proposed capping enrollment in the Child Care Scholarship Program and instituting a wait list, which does not currently have. And there's some shifting of costs to local governments, including teacher pensions and the costs of doing property tax assessments. Although the impact on local jurisdictions is a little unclear, because they also would benefit from some of the income tax increases. Finally, I want to also acknowledge that this discussion is all in advance of any sort of consideration of federal cuts or policy changes that could negatively affect Maryland. There are already some actions that the Trump administration has taken that have the potential or will be disrupting our economy, like the current freeze on activities at agencies with major facilities in Maryland, the National Institutes of Health and the Food and Drug Administration. About 250,000 Marylanders received a federal W-2 in 2021, which is the latest year we have data. That represents about 8% of our workforce. There are 160,000 jobs. Some of those people work in Virginia and DC, but 160,000 civilian federal jobs are located in Maryland, totaling about 11% of wages earned here. They're significantly higher wage jobs, and so they are disproportionately responsible for a large part of the wage income earned in Maryland. There's another $42 billion of federal contracts that went to private Maryland businesses last year, which represents 10% of our state economy. And there's another $19 billion in federal funds that go directly to the state for important programs, as well as, of course, major infrastructure relies heavily on federal funds. For us, we are most concerned about the impact of those cuts to federal workforce or safety net programs. and the idea that they might be used to help pay for new tax cuts for the wealthy and for large corporations. So we are going to keep an eye on that. We'll continue to share information with you and with our partners as we learn more. But for now, I'm going to pause and hand things off first to Tanika Richardson and then to Nonso Muna, who will talk about healthcare, which makes up the largest portion of the state budget. Tanika?
Hey, Ben, thanks for the introduction. So I'm gonna get things started with talking about just some major high-level cuts that we're expecting to see in the Maryland Department of Health. So as of right now, the budget proposed reductions in overall healthcare spending to help address some of the state's budget deficits that you just heard been discussed moments ago. The plan proposes offsetting some of the state's increased Medicaid expenses by requiring insurers and hospitals to contribute more, which is a popular strategy seen across some other states. The biggest change in the healthcare spending, again, I just mentioned, will be the Medicaid deficit. And right now, the governor is proposing kind of offsetting that by requiring hospitals and insurers to contribute more in their spending, which will ultimately result in $138 million savings to the general fund. Some other changes that we're expecting to see will come in the Developmental Disabilities Administration. And I'm going to let my colleague Nonso talk about that more specifically.
Thank you very much, Tanika, and good afternoon, everyone. So, like Ben has talked about, I would like to begin by mentioning the reason why we have this steep cuts in the Department of the Developmental Disabilities Administration, which is facing one of the deeper cuts. According to the state, the Developmental Disabilities Administration had grown at an unsustainable rate from about 850 million to about 1.5, nearly 1.5 million. So they're proposing to make steep cuts beginning FY 2025, which is they're proposing about 160.1 million in cuts. And then for FY 2026, the number is supposed to triple, close to triple to 457.8 million cuts for FY 2026. But I wanted to highlight they had about nine areas where they were proposing some of these cuts. But I wanted to highlight the three where they are proposing will have the most dollars to meet this cost containment measures that they're proposing. And that is modification to the what was described as reasonable and customary wage, the wage that the administration sets for rates for providers and vendors. That is supposed to be about 146.1 million cuts, and also in the they're proposing eliminating the geographical differential. I wanted to explain that is where if you're a provider or a vendor living in an area, the amount that you're supposed to, the rate you're getting depends on the area you're in. So if you're in a high cost area, that affects your rate. So the administration is proposing eliminating that. The other one is also dedicated hours utilization policy change, 108 million cuts to that. Another, so 108 million dedicated hours cuts. There's a policy change meant for that particular proposal. So to continue, I just wanted to highlight the fact that this cut will be impacting about 19,000 individuals who are receiving services from this from the program. There are people in the developmental disabilities community are saying that this is likely to affect both the agencies providing services to people with developmental disabilities, as well as the 19,000 people I mentioned who are currently receiving services through funding. I also would like to mention the fact that this is it's a primarily Medicaid funded program, and those cuts in state funding will also mean foregoing significant federal matching funds for the state.
Thanks, Nonso and Tanika. Next up, we're going to turn to Christopher Meyer, who will discuss the two next largest portions of the budget, K through 12 public schools and higher education.
Thank you, Ben. So K through 12 education is one of the largest areas targeted for cuts in Governor Moore's budget. The biggest change of which is delaying implementation of collaborative planning time, which was one of the major recommendations from the Kirwan Commission and the Blueprint for Maryland's Future. That reduces expenditures by $124 million in FY 2026, increasing to a $500 million reduction by FY 29. So this increase is partly motivated by legitimate staffing issues. School systems are struggling to hire and retain enough teachers for the collaborative planning time to work because teachers are needed in the classroom. But ultimately, really, that's a sign that school systems need more support, not less. The reason that this policy change saves significant state funds over multiple years is that it lowers the foundation portion of the education funding formula, which serves as the baseline for how much each school district receives. Lowering the foundation also reduces targeted aid for students facing barriers in the classroom. And I want to be clear, this has to do with the funding formula and not necessarily actual reductions in collaborative time. So you could see this as sort of collateral damage, really. So, for example, it reduces funding for students from low-income families by $31 million in the coming year, for English language learners by nearly $10 million, and it also reduces local funding relief by $8 million. And these reductions are also almost certain to get bigger in future years. Based on expectations about how prices are going to change over the next year or so, these cuts reduce the inflation-adjusted increase in the per pupil foundation amount by roughly 70%, from a 2.5% inflation-adjusted increase to only 0.7%. This also follows into a reduction in local funding responsibilities. So it's worth noting this delay in collaborative planning time isn't permanent. Eventually, the full blueprint recommendations will be implemented under the current plan, but the lower foundation amount doesn't finish phasing out until FY 2037. There are also some other cuts to public schools, namely in school behavioral health, which is Medicaid funded. That's $90 million. A $25 million cut to special education non-public placements, which is a cost shift to local governments, and also a $93 million cost shift in retirement costs to local governments. In future years, not FY 26, there's also going to be a pause in the phase-in of concentration of poverty funding. Moving on to higher education, which there's no slide for that, so we can just do my head. Base funding for the University System of Maryland declines by $105 million, though the governor's budget does maintain previously negotiated salary adjustments. the governor's budget does not change the so-called CADE formula, which is core state funding for community colleges. It does maintain cuts made last year to that formula. It also cuts nearly $5 million in state contributions to community college retirement costs. Ultimately, since those retirement costs aren't going away, they'll need to be borne by the institutions themselves. So that could ultimately translate into programmatic cuts. And that sums up higher ed. Thanks so much, Ben.
Thanks, Chris. Next, we are going to turn to Musab Ibrahim to hear more about the transportation and public safety portions of the budget.
Thank you so much, Ben. All right, thanks for being here, everyone. So let's get into the transportation budget. All right, so a little bit about the transportation budget. It is funded differently than most other programs. Most transportation projects and operating costs are funded through the Transportation Trust Fund. This has its own dedicated revenue source, the largest of which is the tax on gasoline. In addition to the major shortfalls in the state's general fund that we've mentioned earlier, policymakers are also dealing with major deficits in the Transportation Trust Fund, in part due to the fact that the gas tax is a declining revenue source, I should say. Last year, the legislature took several actions to raise revenue for the trust fund, including increasing vehicle registration fees and creating a new per trip fee for ride share services, excuse me. But it was still not enough to cover the increased costs for the projects and needed transit service improvements without delaying them or reducing the services. So this year, the governor's budget again proposes additional revenue for the Transportation Trust Fund. And sorry, this is not on the slides, but the proposal is a 75-cent delivery fee on packaged food and groceries delivery, limit trade-in allowance for car purchases, to increase vehicle emission testing fees and late fees, and then also to speed up the implementation of scheduled registration fees that were adopted last year. So if you look at the slide here, the total amount that was added to the trust fund this year was $420 million. Additionally, a lot of the capital funding goes towards localities. A lot of that's for highway user revenue grants and other additional funding grant opportunities for transit development. That will be mainly found in the Department of Transportation's capital budget, which this year totals, that should say 3.6 billion. I apologize for that, compared to 3.4 billion in fiscal year 25. And then lastly, on transportation, I did want to quickly highlight federal funds that are coming into Maryland this year. This is from the Bipartisan Infrastructure and Jobs Act passed in 2021. So within that, these are all competitive grants for infrastructure from the federal government. This is $213 million from the Federal Transit Administration to acquire new light rail vehicles. 147 million to the Clean Ports Program to expedite decarbonization in the Port of Baltimore, and then 31 million to reconstruct the berth at Dundalk Marine Terminal. Next slide, please. And so now we're going to shift a little bit to the Department of Public Safety and Correctional Services, or just overall public safety spending in the state. So the overall spending trends, sorry, excuse me, I think my thing just went down. There we go. The overall spending trends, so the Department of Public Safety and Correctional Services budget for fiscal year 26 is $1.87 billion. This is up 13% from fiscal year 25. Additionally, the department has for many years now struggled with its high vacancy rates. For fiscal year 2025, this was at 12.6, and in fiscal year 26, this is now at 11.5%. One major, well, I'm actually going to skip this real quickly, but some of the major improvements or the enhancements in funding for public safety include 4.4 million to the Thrive Academy, which is a gun violence prevention program. an additional 122 million in state aid for police protection programs, $46 million in enhancements for in grant funding for localities. So this could these are competitive grants for Maryland's localities for public safety. The 35 million for the Victim of the Crime Act. This is a continual this is a annual allocation to this fund for this specific fund, and the governor's continuing to fund this this year. 5 million to fill parole and probation vacancies, and 2 million to for additional staff in the newly created Office of Correctional Ombudsman, which is a independent office tasked with overseeing the Department of Public Safety and Correctional Services. And the last thing I'll mention is within the capital budget in Department of Public Safety, there is excuse me, there is so in fiscal 2023, the capital improvement plan, there was funding to create the women's pre-release facility. This is a facility for women who are in pre-release status that unfortunately there has not been a facility up since 2010. So through the work of the Maryland Justice Project, Out for Justice, and the Pre-Release Coalition, their work to add money to the budget came to fruition in fiscal year 2023. And unfortunately, because of the budget deficit this year, the funding for planning of this facility was actually delayed to fiscal year 28 due to just the not having I guess, a full agreement on where the facility should be. And so they're deliberating that still at the moment. And that concludes public safety spending for the governor's budget.
Thanks, Musab. Next, we are going to turn back to Tanika to hear about what is happening with affordable housing.
Yes, thank you, Ben, for that. So real quick, I don't have any slides. I didn't want to throw like a bunch of numbers at you guys, but when we send the notes around, I'll make sure I have some handy documents that I've been using. But just real quick, high level, for the most part, the Department of DCHD, a lot of the programs have remained the same level of funding that we received for last fiscal year. So that's kind of a good thing there. One thing I would like to highlight as far as cuts goes is that there did look like there was some shifting around some funding, like some funding got shifted from one program to another, and that program specifically being the National Capital Economic Development Fund. So $7 million was cut from that, and it looks like it was kind of reshifted to the Baltimore Regional Neighborhood Initiative. So that's mainly one of the only highlight notices there when it comes to funding. Well, cuts, I should say. Another major cut that's also notable is when it comes to like the eviction assistance prevention fund. So if folks been following some housing work across the state, you know that for the last couple of years, we have been lobbying in Annapolis to make sure that we have some type of funding set aside for evictions since the COVID money has run out. So this year we've only received $5 million in a budget, and that is a $5 million shortfall from what we received from last year. Another major investment that we're going to continue to monitor as we plan to see that it's going to impact the budget is the Housing for Jobs Act that the governor is proposing, where he's essentially just making sure that the state and local regions has enough housing units compared to the number of jobs overall. Okay. Some other things too that's connected to the budget that I just want to also highlight real quickly if I still have time is the Right to Counsel bill that passed a couple of years ago. That is what I'm happy to see that did receive funding as well. However, it only received $14 million, which is still far short of the initial amount that we've been asking for, which is like roughly 75 million, to really make sure that the program is up and running and operational to its full capacity across the state. And that's it for me when it comes to housing. Ben, thank you.
Thanks, Danica. Pardon me. We will now go back to Nonso to hear about family income supports in the Department of Health. In the Department of Human Services.
Thank you, Ben. So let me see our slides here. So I'm looking at particularly the Department of Human Services, and we just wanted to mention there isn't a lot of change from the previous FY 2025. So can I, looking for the slides? Thank you. So there wasn't a lot of change from FY 2025, but there was an 8.6% increase from for 2026. And that's about $122 million increase. Mostly some of it is salary increases, but nothing in terms of like new investments. The another area I wanted to take a look at and is the Family Investment Administration, which saw about $110 million increase in its budget. And the two areas I wanted to point out is the Maryland Office for Refugee and Asylees, which is the state office that deals with federally recognized refugees, helping them to be able to resettle in the state. That has seen an increase of about close to 20 million, 9.9 million, from about 47 million in 2025 to about 67 million for 2026. These are all federal funds. Another area that I thought would be important to highlight is the Office of Home Energy Programs. That has seen an increase of about close to 87 million in its budget from 2025. I wanted to highlight that I think last year or so, when if you apply for either SNAP or Medicaid, you automatically enroll into the home energy program, which enables families to be able to pay for their energy needs, especially low-income families. So that has been helpful in getting more people into the program. And as you can see here, also there's an increase in the budget for that office. And those are the two main things that I feel that are important to highlight for this particular area.
Thanks, Nonso. The next section of the budget that we will discuss is the Department of Labor and also economic development programs. Chris is going to return to the screen to cover those sections.
Thanks, Ben. So the Department of Labor did have actually some fairly significant funding increases, primarily driven by legislation enacted in past years. So the total increase to the Department of Labor is $116 million. And that's $109 million $109 million in state funds, a $7 million increase in federal funds. That includes an increase in 125 positions within the department, and that's through both an FY25 deficiency and funding for FY26. And those positions are all in the Division of Unemployment Insurance. Some folks might remember from 2020 that there was really an administrative debacle in 2020 with unemployment insurance, people getting delayed payments or getting denied inappropriately. There have been kind of a long-term trend of reduced staffing within the division, So this is an important effort driven by legislation enacted in past years to rebuild the division and make sure that we are serving unemployed workers in Maryland fairly. As far as cuts, no, I'm going to go with new investments first. So those new investments in the division of unemployment insurance total $45 million increase. 33 million of that is state funds, a 12 million increase in federal funds as well. The other major increase in the budget is ramping up implementation of the Time to Care Act, that's paid family and medical leave. This is again just administratively preparing, building up infrastructure for this. Obviously, paid leave is not yet actually available to workers. But this is a $45 million total increase, which includes $54 million in increased state funding, partially offset by a $9 million loss of federal funds. And again, this is driven by legislation already passed in past years. And then this is not the Department of Labor, but it's worth noting that the governor's budget also includes $23 million in new funding for his signature Enough Act, which is place-based investments intended to increase economic opportunity and fight child poverty. There are some relatively small cuts to the Department of Labor budget. Those cuts are, minor in quantitative terms, but still harmful. It's just under $1 million in total cuts. That includes reducing the Construction Education Innovation Fund, reducing the Maryland New Start Act, completely eliminating the rent court funding for Montgomery County and PG County to help people stay in their homes, and reducing funding for career pathways for healthcare workers. Moving on to economic development, I do not currently have actually a quantitative breakdown. Anyone who wants more detail on that, I can follow up afterward, probably next week. But there is a significant shift in the composition of funding. The governor has introduced a significant amount of new economic development funding based on his economic growth strategy. But there are also some significant increases, notably phasing out the enterprise zone program. The Department of Legislative Services has done evaluations of enterprise zones and found that the program is largely ineffective. So I would say that getting rid of that program is probably a positive change, especially because academic research has in general found that business subsidies meant to promote economic development are generally ineffective, and they don't generally bring significant returns for workers. And of course, that uses revenue that could otherwise be going toward more effective state services. And with that, I will pass it back to Ben.
Thanks, Chris. So we are going to move to audience questions now. So make sure, I know we've got a number of questions already, but please feel free to continue submitting questions using the Q&A feature at the bottom of your Zoom screen. So we've got a couple of process questions about the budget. First of all, if the governor proposes a budget that then changes because of federal funding cuts, does the Maryland state budget need to be reworked again before it gets passed in session? So the short answer is they will always try to incorporate whatever the best information they have into the budget. We will get revised revenue estimates in March before they finish the budget process, which will likely include whatever impact of federal action we're starting to see or starting to be able to project. So they'll pass a budget by the end of the session, early April, that will be balanced based on the best information they have available at that moment. If a couple months later they find out, oh, actually, what of the many examples could I pull out? They've eliminated the Department of Education and turned all the funding that goes to states into a block grant, and it's 75% of what we were expecting, not 100%. Well, what the first step would be is the Board of Public Works can make cuts to the state budget in between legislative sessions. The board meets every couple weeks and is made up of the governor, the comptroller, and the state treasurer. They have significant budget powers to react to things like that are big and happen in between sessions. The other thing is our fiscal year runs from July 1st to June 30th. So when we come back in January of 2026, we'll only be halfway through the budget year. And so the legislature would then have an opportunity to make revisions to the budget that we're currently in to respond to anything else or anything that was large enough to exceed the authority that the Board of Public Works has to make cuts, which, if I'm recalling correctly, is 20%, 5% of any line item. The other question was about testifying on budget analysis hearings. Generally, and somebody correct me if I'm wrong, because it's actually been a while since I personally did this, but you can submit written testimony. Do check the deadlines for the specific committee, whether you're on the Senate or the House side, because those aren't always the same for when you need to get that in. But all that information is available on the General Assembly's website. And you can now submit written testimony virtually. You don't have to go physically down to Annapolis anymore. Unless something has changed in recent years, I don't believe generally they take oral testimony for the budget. Am I okay? Nobody's jumping out of their chair to correct me. So but the rules for each committee are on the General Assembly website, whether you're talking about the budget or any other issue. Nope, I am getting a correction. They do take oral testimony. So I apologize. It's been a couple years since I was personally doing that. Let's focus on a couple of, I think there are a number of questions about education, Chris, so I'm going to turn to you next. And I think the first one that I see is how the things you were talking about impact maintenance of effort levels by local school districts.
Absolutely. So there are kind of two, and I apologize if I'm telling you things you already know. There are two major determinants of local funding responsibilities. The first of those is the local share of formula funding, and then the second of those is maintenance of effort to make sure that counties aren't reducing their support for public schools over time. So looking at only the local share of formula costs, the Public Schools Superintendents Association of Maryland, PSAM, estimates that the foundation cuts, which also ripple through to comp ed, English earners, and so forth, will reduce local funding responsibilities by about $112 million in FY26. That said, the actual reduction in local funding responsibilities might be less than that, because if that pushes the local share below maintenance of effort, which is again based on historical local funding. The counties would still have to maintain maintenance of effort. So the max reduction in local funding responsibilities is $112 million. It's possible that the actual reduction will be less than that. And then, of course, it's possible that the actual reduction in funding that the counties send to schools is less than that if they send more than the amount they're required to by law.
And Chris, two maybe quicker education questions. When you're talking about in-school behavioral health, there was just a clarifying question if you're referring to the consortium.
Yes.
All right. And then could you talk a little bit more about what this what collaborative planning time is? Like, what are we actually talking about when they're talking about this slowdown?
Sure. Yeah. I would say definitely I can follow up afterward with more detail on what that is based on the Kerwin Commission report and what's in the blueprint bill. But in general, there are kind of two components to it. The first of which, anyone who's ever been a teacher knows that you can't just walk into the classroom and start teaching. You need to actually prepare. And so this reduces the amount of time teachers have to actually spend teaching, gives them more time for planning to make sure that they have adequate time and aren't being required to do a lot of work outside of official hours. And then the collaborative component of that is having teams of teachers work together on sharing best practices and really implementing the most effective possible lessons. But again, I should definitely follow up with you with more details based on the Kerwin Commission report.
I think we have a question about climate change. So Musab, I'm going to call on you. If we didn't talk about it in our main presentation, but are there any changes related to climate change funding?
Yes, thank you, Ben. And yeah, apologies, we couldn't fit it in the presentation. There are a few major changes to climate. One of which I'll mention is the Strategic Energy Investment Fund. I believe this is a fund that supports the state's climate pollution reduction plan. So I think that for fiscal year 26, this was, and sorry, I just want to double check my notes. Right. So this will total 180 million in investment for fiscal year 26. And this goes towards, like, for an example, I think 50 million will go towards developing solar energy for state property. And an additional 80 million for solar and geothermal development, also on state and public facilities. There's also a good portion of this that's made up in block grants for localities that have their own climate change plans and pollution reduction plans. This totals about 60 million for fiscal year 26. Those are probably the more major updates in climate. But of course, if anyone has any specific questions about any of these funds, I'll be sure to follow up with you after.
Great. We had a question about the 75-cent delivery fee and who this would realistically impact. I think it would pretty much impact anyone who's using these services. I think we're still figuring out exactly who that might be. I do want to point out that although it would apply to grocery, well, the language is a little confusing here. So it only applies to things that the sales tax is already charged on. So if you got a grocery order, if that grocery order was only groceries that are not taxed, then there would not be a 75-cent delivery fee on that purchase. But if you bought things there are things that the grocery store sells that are taxable. Maybe you got I don't know, a Valentine's Day bear from the grocery store, because that seems to be a thing they sell around this time of year. They would charge you sales tax on that, and therefore you would pay the 75-cent delivery fee. So the considerations of who's impacted is essentially the same as the sales tax, with a little bit of modification, because not everybody is likely to use delivery services in the same way. So that's what's different about it versus the impact of the sales tax more generally. Chris, we got a question about the interaction between the cuts that we see in this budget, and also potentially tax increases. The person asking the question is particularly concerned about property tax, it looks like, but just if you could speak a little bit about the interaction between cuts and taxes on seniors.
Sure. I'll start by addressing the tax portion. First off, the state property tax is not going up. There's no change to that. As far as whether the income tax changes will affect seniors, first, the rate increases are targeted exclusively to people with incomes above $500,000 a year, and that's taxable income. So after any deductions, personal exemptions, and so forth. So that's really only affecting the wealthiest individuals, who in general are not going to be struggling to pay their mortgages. Changes in deductions in the tax code. Any seniors who are currently taking the standard deduction are going to see a tax cut from doubling the standard deduction, as well as a smaller cut likely from reducing the rate that most folks are paying. For any seniors who take itemized deductions, and I want to make clear that especially for people with low to moderate incomes, the vast majority are already using the standard deduction. But anyone who is using itemized deductions could wind up paying more. It's also important to keep in mind that the state has a large number of tax breaks exclusively going to seniors, which for the most part are not targeted to those in the greatest need. Most recently in 2022, lawmakers passed hundreds of millions of dollars per year in a non-refundable tax credit going to seniors. That was a much less unbalanced tax cut than the one that then Governor Hogan initially proposed. But it is important to keep in mind that our tax code is heavily favorable towards seniors. Regarding budget cuts, off the top of my head, I'm not sure about any major impacts on seniors, but I can possibly get back to you on whether there is anything of that nature.
Okay, we are approaching the end of our webinar. I know there was one question about the impact of these changes on nonprofits. I don't know that we necessarily know that yet. Certainly, if you're a nonprofit that is funded by one of these programs that we have highlighted is slated for cuts, that may certainly impact you. But certainly lots of government state services are delivered by nonprofits across the state. Let's speak, and nonprofits employ lots of people across the state. but I don't, unless you're asking us about a specific um, item, I'm not, or a specific program, it's a little difficult to say until the budget's actually passed what those might be. Are there any new proposed deductions for caregivers? So I think that this is, I'm not sure if this is in the context of caregivers like family members, or are we talking about caregivers that you might hire to take care of your loved ones? Either way, I don't believe there are any proposed deductions that I'm aware of in what the governor's put forward for either of those categories. There are, I guess you could say, if we, you know, to the extent that we are thinking about strengthening the child tax credit, that certainly would help caregivers of children. But that's, I think, about the closest we get to something like that. And we will definitely send out the links that were requested to everybody who signed up for this webinar, as well as the recording. So I want to, we're going to wrap up here, and thank you everyone for participating today. We did just have a question come in asking about the impact of the various executive orders that have been set. My understanding, and certainly others of our team should speak up if they're aware of anything, but the impact of the executive orders that the Trump administration has signed so far are not things that directly impact the budget in a one-to-one sort of way. They will impact the state's economy and therefore the state's budget by, for example, if we're closing and laying off every DEI federal employee in Maryland, that's definitely a non-zero number, and those people are going to need unemployment. They're going to reduce their spending in the local economy, and which will increase their need for services and reduce our tax collection. But so far, I have not yet seen an executive order that creates a one-to-one, like dollars that are passing through the state's budget impact. All right. Well, thank you, everyone. We are going to wrap this up, and certainly keep in touch. We will send this out to everyone who registered, and we'll be continuing to update our budget analysis of both the governor's proposal and any changes the legislature makes in the coming weeks. So please continue to follow us at mdeconomy.org or across all sorts of the different social media platforms. And please let us know if you're hearing your own information from your own sources about changes to the budget. We always, this is a collective effort to make sure we're all as informed as possible. So thank you again, and be well and have a great weekend.